Addiction is a disease, not a moral deficiency. It's actually a brain disorder. At Triumph, we treat addiction in a wide variety of ways.
At Triumph, we recognize that client-patient-based services is where it's at. So every patient's going to have their own specific problems and their own specific needs, and the way that we treat their disease could look very different from patient to patient.
We've got a full spectrum of services that we do offer. We've got outpatient at a couple of levels, and we have inpatient services for men, for women, and for women with special needs. And so depending on what a person's need is, we are able to offer them services that are appropriate and that are ASAM recommended, fit the criteria.
We always focus on the need of the patient. So if the patient needs a certain resource, we focus on that. That's what has been most beneficial for them to abstain from drugs and alcohol.
Addiction has a significant effect on the family of the person suffering from addiction. The family is key to successful treatment.
How the disease of addiction affects family members is they are in a situation with their addict that leaves them feeling like they have to take care of this person, that they have to do certain things that enable them, and it actually is not beneficial for the addict. The addict needs to feel the full consequence of his disease, and the family members suffer greatly.
Addiction is like any other disease. So when a person is afflicted with this disease, the whole family suffers. They are all going through the emotional turmoil.
The signs and symptoms that an individual may be having with the disease are going to be similar with the family. Their level of denial especially can mirror what's going on, knowing there's a problem but not wanting to name it.
Triumph has a wide range of specialized programs to suit different people and different circumstances. These programs include inpatient treatment, outpatient treatment, and specialized treatment for men, women, and families. There are treatments aimed at addiction in all stages of severity.
We have 3 level 3.3 PPW programs. PPW stands for Pregnant and Parenting Women. We were one of the first in the nation to recognize that the main barrier for treating women with substance use disorder was also accommodating their need to do treatment with their children. What we're doing here is so impactful because the women are learning in treatment how to do recovery and how to parent their children at the same time.
Triumph Treatment Service has an outpatient program, so the people that are local, if they are in an inpatient facility at Triumph, either Inspirations or at James Oldham, they have the benefit to stay connected to Triumph Treatment Services, which has been very beneficial for them, and they have that sense of security that the addicts need. We also have family programs that really help the family, and we always focus on the need of the patient.
Thorough diagnostic assessment is the foundation for every person seeking information about their alcohol or drug use. Assessment is a great way to find answers to questions and obtain recommendations that are tailored to the individual.
The assessment process is the gateway into treatment services, especially if you've never had an assessment done. Really all you have to do is, have a need, go in, be honest, and we will do the best job that we can for you with determining whether or not you have a problem. And then once that's determined, discussing with you and determining the best way to proceed with treatment.
A wide range of funding is available, including fee-based, private insurance, and various types of public funding. Triumph has a complete range of linked services that will help a person complete a successful journey to recovery. Linked services are very important to recovery because they form a path that allows the patient to build self-sufficiency in continuing increments.
Linked services are really important for the recovery process. We're talking about not only the education and support through the treatment itself, it's building those relationships outside in the community as well.
They have all kinds of different programs. They have an inpatient women's facility, which is a 16-bed facility. They have outpatient services. They have JOTC, James Oldham Treatment Center. It's a 78-bed all-men inpatient facility where we help them with the tools that they need in order to abstain and be in recovery from the disease of addiction.
Triumph's continuum of care model focuses on addressing chemical dependency, preparing chemically dependent people with tools to recover, and facilitating aftercare options that allow for sustainable recovery. Triumph offers a strong continuum of care that supports the patient and their family, gaining the tools for the goal.
One of the really great things about Triumph is that we offer services across the entire continuum of care. You can get anything done at Triumph, from assessment to a level 3.5 intensive inpatient service to a level 3.3 long-term residential program like we have on the campus, as well as outpatient.
Triumph has been saving lives and helping with recovery for over 50 years. We have an excellent success record of offering safe paths to health and hope.